And the purpose of this public hearing is to hear testimony on bills number 161, 111, and 170470. I want to recognize the presence of a quorum of committee members. Members of committee in attendance are Councilman Derek Green, Councilman Bill Greenlee, and Councilman Al Toggenberger. And if we could now have the clerk read the title of bill number 161, 111.
Bill number 161111, an ordinance amending Chapter 9-900 of the Philadelphia Code entitled Professions to add a new section 9-903 entitled Conversion Therapy, adding definitions and prohibiting the practice of conversion therapy by mental health providers on patients under 18 years of age under certain terms and conditions.
Thank you very much. And if we could have the clerk call the first witnesses and panel to testify.
Amber Hikes, Director of LGBT Affairs, City of Philadelphia.
Good morning. And thank you for being here this morning. Before you begin your testimony, we did want to recognize this is the one-year anniversary of the massacre in Orlando. And we wanted to ask if everyone would just if we could just have a moment of silence. Thank you. And thank you for being here. We just wanted to acknowledge, that this is a very important topic. And it's actually timely with this conversation we're going to be having here today on this particular bill, 161111. So if you want to start with your testimony or state your name for the record and begin your testimony.
Thank you so much. Thank you so much for having me. My name is Amber Hikes, and I'm the Executive Director of the Office of LGBT Affairs for the City of Philadelphia. So, good morning, Chairwoman Bass, and the members of the Public Health and Human Services Committee. I am Amber Hikes, the Executive Director of the Mayor's Office of LGBT Affairs. The Office of LGBT Affairs develops priorities for the city on issues including public safety, education, economic development, health and city services, and civil rights regarding LGBTQ Philadelphians. As Executive Director, I develop policy and serve as the Principal Advisor to Mayor Jim Kinney on issues that affect the LGBTQ community. Thank you to Councilman Squilla for introducing this bill and for the opportunity to support legislation prohibiting the practice of conversion therapy by mental health providers on individuals under the age of 18. Conversion therapy is a hateful and harmful practice that is condemned across the country by mental health and nonprofit organizations as well as government institutions. California, Connecticut, Illinois, New Jersey, Oregon, Vermont, New Mexico, Nevada, and the District of Columbia have all enacted laws that prevent licensed mental health providers from offering conversion therapy to minors, and more than 20 states have introduced similar legislation. From a municipal perspective, 18 cities, including Pittsburgh, already have standing bans on conversion therapy for minors. This archaic form of treatment is based on the abhorrent ideology that same-sex attraction and behavior is a chosen abnormality and is inherently wrong. The belief that same-sex attraction and behavior is in need of treatment is in opposition to the position taken by all major national mental health organizations, including the American Academy of Child and Adolescent Psychiatry, the American Association for Marriage and Family Therapy, the American Counseling Association, the National Association of Social Workers, the American Medical Association, the American Psychiatric Association, the American Psychological Association, and countless others. Same-sex attraction and behavior is not a mental disorder, but undergoing reparative or conversion therapies has the potential to harm youth and can lead to the development of serious mental health disorders. Conversion therapy is not just dangerous, it can be lethal for our youth and young adults. Research on the issue of family acceptance in LGBT youth conducted at San Francisco State University found that highly rejected LGBT young people were 8 times as likely to have attempted suicide, 6 times as likely to report high levels of depression, and more than 3 times as likely to use illegal drugs than young people who do not experience rejection. From a clinical perspective, there's absolutely no evidence that sexual orientation can be altered through therapy, and that attempts to do so can be harmful. After nearly 40 years of this harmful practice, there remains no evidence that efforts to alter sexual orientation are effective, beneficial, or necessary. In fact, the only evidence suggests that these practices do harm. At its core, conversion and reparative therapy is a rejection of LGBT youth. Indoctrinating youth and young adults with the belief that same-sex attraction must be eliminated not only increases one's self-hatred, but can also lead to depression, hopelessness, guilt, social withdrawal, and suicidality. The Office of LGBT Affairs wholeheartedly supports Bill number 161111 and any measures to protect, affirm, and support LGBTQ youth in Philadelphia. Thank you to Councilman Squilla, Chairwoman Bass, and the members of the Public Health and Human Services Committee for your time and effort addressing this important issue that affects LGBTQ Philadelphians deeply. I appreciate the opportunity to testify, and I'm here to answer questions at this time.
Thank you very much for your testimony. Can you talk a little bit about conversion therapy here in the city of Philadelphia and what, from your knowledge base, is occurring, the possibilities of what could be occurring if we do not act on this particular piece of legislation, what the potential issues might be further down the road?
Absolutely. To my knowledge, there have been conversion therapy treatments and therapy centers that have been in Philadelphia in the past. But to my knowledge, I do not know of any that are existing in Philadelphia at this time. I do believe that they have been pushed out of the city, but certainly that is just what I know in terms of the record. There are certainly possibly centers and clinics that are operating underground.
Okay. Good to know. Good to be aware. Thank you very much. Councilman Green?
Thank you, Madam Chair. Good morning, Ms. Hikes. Thank you for your testimony this morning. I guess one of my concerns is that some of the entities that engage in certain practices, once they know that the phrase is no longer politically correct, they change the language or the methodology to something different, or they cloak it in either a religious therapy or some other perspective. Have you seen that in other jurisdictions where entities that previously were calling their practice conversion therapy now are using some more benign term, but still trying to do the same type of process, but doing it different in the cloak of something different when it's really the same?
That's exactly right. So you're absolutely right that conversion therapy has a certain connotation to it, and so they've changed the terminology, sometimes using reparative therapy, but always under the cloak of a religious practice, reparative therapy, always under the cloak of a religious practice. And that is particularly damaging because, as the councilman said, it is exactly the same practice that is being indoctrinated on our youth and our young adults that has the same harming effects, but it's just under a different brand. Absolutely.
And you said reparative therapy, other types of language, and would this bill cover those issues as well? If someone were to try to use a more benign language to really do the same thing?
To my knowledge, the bill covers both conversion and reparative therapies.
The only area that my concerns, if it had any type of religious perspective, that would be somewhat beyond the scope of this bill.
I cannot answer that if it's still under, if it is covered under religious, like some religious jurisdiction, I can't speak to that.
Thank you, Councilman. Councilman Toggenberger?
Yes, thank you, Madam Chair. And Ms. Hikes, thank you very much for your testimony, very insightful. I do have a question. What would your view be of enforcement of this bill? I mean, who enforces it if you see a problem?
I do not know. I cannot answer that at this time in terms of who would actually enforce this bill.
I mean, I see the reason for the bill.
Of course.
I will be in support of it, but who really, if somebody really sees this going on, it's a flagrant violation of what you would consider, what do we call? What do we do? That's really my question.
Right. Okay. If I could, I would suggest
Please,
that your office could come up with some guidance for us in terms of who would do enforcement, what enforcement would look like, and so forth.
Absolutely.
And so, we can work with the proper city agencies to see that through. Councilman?
Absolutely.
Green?
Go ahead,
Yeah,
Chief.
just looking at the bill, it calls for fines, penalties, and also revocation of a commercial activity license as required by Title 19, which more likely that would go to license inspection. My only concern is that, similar to what we have with the Fair Practice Ordinance, that entity could create a new entity, so they can call themselves Philadelphia Conversion Therapy LLC, get fined, and then come up with a new license and call them Philadelphia Restorative Therapy LLC. And that's something that we made an amendment change for the Fair Practice Ordinance to change that perspective because of that same issue. I'm not sure that's something that the sponsor, Councilman Squilla, would think about, but that's one of the concerns I would have, that someone could be fined and have a license ultimately revoked and then start again in a new shop.
That would be my concern too. The first thing I thought was a fair practices ordinance, but I didn't think that it would be able to fall under their current jurisdiction. But you're right, if we could amend something within the FPO, then I think that would be very helpful. And certainly my office will come up with some guidelines around that for sure. We can do that.
Councilman Toggenburger?
I'm just commenting at this point, it's not a question, but maybe if you could give what your thinking would be. I actually think in looking at this, and particularly the high fine, and I have no objection to that, nor do I have any other objection in the language except who's enforcing it, but I would have to actually say that I'm not certain now and I would be equipped to do this. They're dealing with signs, they're dealing with a lot of other things, and not like what is involved in therapy. I would suggest possibly, and then in talking to my colleagues, maybe the health department having some oversight to this. Thank you, Madam Chair.
Thank you, Councilman. That's something that could be considered, but also, I'm thinking of Human Relations Commission. So there's just a lot of things that, we need to explore further. Councilman Greenlee?
Madam Chair, thank you. Just to add to that, oftentimes once we pass a bill, then the administration deals with regulations. And I think this would fall into trying to figure out what the regulations, how to do that. Oftentimes the total enforcement is not defined in the bill. It's worked through with regulations. So, yeah.
Absolutely.
Thank you.
Okay. Thank you very much. Thank you for your testimony, unless there are any other questions. It doesn't appear to be any. Thank you so much for your testimony. If we could have the clerk call forward the next witnesses.
Dr. Jeffrey Niemark, Department of Behavioral Health and Intellectual Disability Services, Chief Medical Officer, Community Behavioral Health.
Good morning. Please state your name for the record and begin your testimony.
Good morning. I'm Dr. Jeffrey Niemark. I'm the Chief Medical Officer at Community Behavioral Health. Good morning, Chairwoman Cindy Bass and members of the Public Health and Human Services Committee. I'm Jeffrey Niemark, Chief Medical Officer at Community Behavioral Health for the Department of Behavioral Health and Intellectual Disability Services. Thank you for this opportunity to testify in support of Bill number 16111, which is an ordinance that was introduced by Councilman Squilla to add Section 9903 to the Philadelphia Code, prohibiting the practice of conversion therapy by mental health providers on individuals under 18 years of age. DBH-IDS achieves our mission to improve the health status of Philadelphians through an emphasis on recovery-oriented and resilience-focused behavioral health services. Our goal for these services is to facilitate individuals realizing their goals and attaining the highest quality of life possible. We work with individuals, families, and providers to assure that services are accessible, effective, appropriate, and of high quality. CBH, a component of DBH-IDS, is a managed care organization with moral, ethical, and professional obligations to ensure that practices being funded do not cause harm to individuals participating in services. Section 9903 will protect youth from conversion therapy, a dangerous and discredited practice aimed at changing sexual orientation or gender identity. This amendment will provide clear guidance to providers and the community that conversion therapy is harmful and unacceptable practice among mental health providers within Philadelphia. Lesbian, gay, bisexual, and transgender youth who are exposed to conversion therapy are at heightened risk for depression, substance abuse, and suicide. By educating parents and the public about the harmfulness of these practices, this amendment will help improve health outcomes among vulnerable youth. The nation's leading mental health associations, including the American Psychiatric Association, the American Psychological Association, the American Counseling Association, the National Association of Social Workers, the American Academy of Pediatrics, and the American Association for Marriage and Family Therapy, have issued position statements warning about the dangers of these practices. The American Academy of Child and Adolescent Psychiatry in 2012 published an article in their journal, the Journal of the American Academy of Child and Adolescent Psychiatry, which stated, and I'm quoting, "Clinicians should be aware that there is no evidence that sexual orientation can be altered through therapy and that attempts to do so may be harmful. There's no empirical evidence adult homosexuality can be prevented if gender non-conforming children are influenced to be more gender conforming. Indeed, there is no medically valid basis for attempting to prevent homosexuality, which is not an illness. On the contrary, such efforts may encourage family rejection, undermine self-esteem, connectedness, and caring, which are important protective factors against suicidal ideation and attempts. Given that there is no evidence that efforts to alter sexual orientation are effective, beneficial, or necessary, and the possibility that they carry the risk of significant harm, such interventions are contraindicated. DBH-IDS fully supports the aforementioned medical community member organizations' positions on the danger of conversion therapy. Contrary to conversion therapy, DBH-IDS recommends the adoption and practices of therapies that provide support or acceptance of LGBT identities, facilitate support or identity exploration, and that address problematic substance use or unsafe sexual practices. On behalf of DBH-IDS, I wish to thank Councilman Squilla, Council President Clark, Chairwoman Cindy Bass, and members of this committee for your consideration of this critical issue and the opportunity to testify. We look forward to working with Council and other stakeholders as we continue to support our most vulnerable citizens, and I am happy to answer any questions that you might have.
Thank you very much, Doctor, for your testimony. I think it was very comprehensive and really covered pretty much every question that I thought I was going to have for you. But I just really wanted to highlight one of the things that you said, which was in your testimony that there was no evidence that efforts to alter sexual orientation are effective, beneficial, or necessary, and the possibility that they carry the risk of significant harm. And just really, how are we as a city continuing to spread that message? How are we from your office to our individual council offices? Do you have any particular recommendations in terms of how we can spread that message so that folks can understand where we as a city are? I think that for the most part, people understand that Philadelphia is really, in my opinion, at the forefront of addressing these sorts of issues and being on top of LGBT issues, and that there's a lot of support within our city framework and infrastructure and government to make sure that people are protected. So is there something in particular that your office is doing, our offices could be doing more, better?
I think it's a great question. Our message has been rather universal in terms of celebrating recovery, resilience, and I think celebrating individual identity. Where I think the opportunity lies is to perhaps focus on some of the more vulnerable or most vulnerable folks. And so I think perhaps specific and targeted messaging, both by our office or in combination with the Department of Health and City Council, reaching out to say the communities involved in this would be helpful. And I think, despite the fact that we've created a particular position and section at DBH-IDS, I think there are ongoing opportunities to enhance the messaging, and I would be happy to work with members of council, you specifically, in terms of enhancing that.
That'd be great. We can probably work with maybe Councilman Squilla's office to continue to find ways to enhance the message.
Might I add one thought from the prior questioning in terms of the enforcement, and I think the questioning around the business license. One way to approach that is to think about targeting the individual's professional license, because that sticks with the individual provider. So if it's a psychiatrist, a licensed clinical social worker, a psychologist, filing complaints with the state licensing board around that would not allow them to just pick up and go from place to place, whereas revocation of a business license would allow them to just incorporate again. It's something to consider, and certainly DBH-IDS and my office would be happy to be part of the operational planning around enforcement of this, because I think it's a critically important question, and I think thinking that through would be helpful.
Thank you for that. Thank you so much. Councilman Green and then Councilman Toggenberger.
Thank you, Madam Chair. Thank you, Dr. Niemark, for your testimony and for providing us a professional perspective from a number of leading mental health associations regarding this concept of conversion therapy. Also, thank you for the concept regarding the professional licensure aspect. And I just had a chance to reach out to my staff regarding the Fair Practice Ordinance. Under that ordinance, the Fair Practice Ordinance comes under the Philadelphia Commission on Human Relations, and under the framework we put together allows for a cease operation of an entity that's engaged in a business that's discriminating against others in the city of Philadelphia. We have the ability to cease their business operations for a period of time. So I think having some possibility of cease operations on this legislation would be good. I think coupling that with your idea of reporting some type of notation to whatever their licensing board at the state level would also be helpful. From your experience at CBH and also working with the Department of Behavioral Health and Intellectual Disability Services, has there been any type of either regulatory or quasi-judicial process that either CBH has had or the department has had regarding legislation that could be used as part of this legislation that you're aware of?
I'm sorry, can you, I didn't hear the part about experience around which.
From your experience at both CBH as well as working with the Department of Behavioral Health and Intellectual Disability Services, have you seen any scenarios where any of those entities have been placed in a kind of quasi-judicial scenario under current legislation where they're making decisions on a license being removed or cease operations occurring?
I believe around the pill mill legislation, there was an operational plan that involved DBH, CBH in terms of some of the considerations of whether there were problematic prescribing practices going on. So that was, I believe that may have been legislation introduced by Councilman Squill as well, but there is a precedent around that.
Right. Yeah, the reason I'm saying that because, generally anything we have in Title IX of the Code dealing with professions, it automatically goes to L&I for any type of fine or cease business activity license process. I think having another entity like possibly either CBH or the Department of Behavioral Health and Intellectual Disability Services to provide that quasi-judicial decision-making aspect, I think would be helpful because I think L&I already has a full plate of issues that they deal with, and considering this is dealing with mental health aspects, and both those entities have a very direct knowledge and relationship with mental health, I think it would probably more apropos for those entities to be in the decision-making process, possibly finding and or doing some type of cease operations, as well as providing any type of notation to any state regulatory body for people in these licensed areas.
Yeah, I agree. I think there's an opportunity for DBH IDS to be part of the, integrated into that process, and in particular to lend expertise on the evaluation of the sorts and types of therapy that may be rendered or under consideration, and that would bring forth a recommendation as to whether this was in fact conversion therapy or not.
Okay. All right. Thank you. Thank you, Madam Chair.
Thank you. Councilman, are you good? Okay, very good. Thank you very much for your
Thank you.
testimony. And can we have the clerk call up the last witness to testify?
Jason Landau Goodman, Executive Director, the Pennsylvania Youth Congress.
Good morning.
Good morning.
Please state your name for the record and begin your testimony.
My name is Jason Landau Goodman. Good morning again, Councilmember Bass, members of the Public Health and Human Services Committee. I am the founding executive director of the Pennsylvania Youth Congress. On a personal note, my family's from Philadelphia, for 5 generations, and I'm a recent graduate from Penn. The Pennsylvania Youth Congress is our Commonwealth's first and only statewide lesbian, gay, bisexual, transgender, and queer youth organization. We work to empower young LGBTQ Pennsylvanians through advocacy in local and state government on issues impacting their lives. The elimination of conversion therapy is one of our key policy concerns. We thank you for addressing this critical issue from Philadelphia. Conversion therapy is a barbaric practice that has no place in a civil society. The National Center for Lesbian Rights notes that conversion therapy encompasses averse conditioning, such as including harmful physical reactions when exposed to LGBT imagery, and a variety of behavioral, cognitive, psychoanalytic, and other practices to change or reduce same-sex attraction or alter a person's gender identity. Conversion therapy of today is a vestige of its predecessors, such as institutionalization, forced castration, and electroconvulsive therapy. As Pittsburgh City Council President Bruce Krause, an out gay man, shared before their vote on their ordinance last year, I look at conversion therapy as a form of soul murder. The practices of conversion therapy are discredited and outright rejected by all leading professional health and mental health care associations, including the American Psychological Association, the American Psychiatric Association, and the American Academy of Child and Adolescent Psychiatry. The practice of conversion therapy often leads to devastating outcomes, including a compromised mental health, depleted self-worth, abuse of drugs, and suicidality. Conversion therapy, as you heard, has been banned for minors in 8 states and Washington, D.C. Nearly 24 cities have done the same, from Seattle to Key West. Pittsburgh became the first jurisdiction in Pennsylvania to do so in December of last year, when their ordinance was unanimously adopted by their city council. Philadelphia is poised to join this group of cities in declaring that conversion therapy has no place in our community. General legislation to ban conversion therapy for minors has languished in the Pennsylvania General Assembly for the past several sessions. In 2010, however, the Office of Mental Health and Substance Abuse Services within the Pennsylvania Department of Human Services adopted a policy that from the state that they do not endorse or pay for conversion therapy. We know this is real. We have individuals in Pennsylvania and across the country who have survived it. They are our friends, and they have resilience that many of us will never know. While we are monitoring a decrease in its application, it is still legal unless you act. As Philadelphians and as human beings, we consider moving this bill a moral imperative. You will be sending up a beacon to the world that from Philadelphia, you are loved and affirmed for who you are, and efforts to warp your mind against yourself are inhumane and surely against the law. Philadelphia is a city of sibling love, and that is what you are exemplifying in moving this legislation forward. Thank you for looking out for members of our family. The Pennsylvania Youth Congress commends you and Councilman Squilla for your leadership on this issue. We urge you to report this bill from the Public Health and Human Services Committee and approve this critical measure as City Council. Thank you, and happy to answer any questions.
Thank you very much for your testimony and for all of the work that you do. And I'm really encouraged that the Pennsylvania Youth Congress exists and for the work that you do. And also that as I see it, this is the group that's really going to carry the torch to make sure that conversion therapy is extinguished, not just in Philadelphia and in Pennsylvania, but nationally, internationally. That this is something that will not be accepted in the future, and I think that it's certainly much more of a common thinking among your membership, younger generation, that conversion therapy is problematic and has to go. And so I just really want to thank you for the work that you're doing and continuing to do on this very important issue. So, Councilman Green?
Thank you, Madam Chair. Good morning. Thank you for your testimony. You spoke about the legislation banning conversion therapy languishing in the Pennsylvania General Assembly. Can you give some more context to that and maybe provide some information on who have been some of the sponsors of legislation to ban conversion therapy and what the current status is on any of those bills?
Sure. So the past, I believe it's 3 sessions, legislation has been introduced in the House and the Senate. I believe Senator Farnese has been involved in one of those bills, and a number of Philadelphians are co-sponsors of those bills. The legislation has not been moved out of its committee. We don't necessarily see a path forward until we have more support. We're still working on basic non-discrimination. We may see movement from that through guidance in the Pennsylvania Human Relations Commission, which may lead to us being able to figure out additional regulations through the state. In New York State, the way they banned conversion therapy for minors was through a regulation. So with Philadelphia and Pittsburgh leading the way, perhaps we can see movement from the state level. But OMSAS, as I mentioned, the State Department of Human Services, has prohibited state money from their office being used for this conversion therapy.
So you raised something interesting about a strategy using the executive branch doing regulation. Is there ability, well, going back to the New York process, we used the regulatory authority to eliminate this practice. Is there ability for the state, or I guess I'm not sure if that's the health department or another state licensing entity, to make a decision that they're not going to provide a license to those who practice conversion therapy?
I gather that may be a possibility, but I am not sure how that would play out at the state level, but we can get back to you.
Yeah,
Or
and I
at
think-
the city level too.
Yeah, I think the concern the challenge right now is that the Governor Wolf has proposed merging a number of agencies together.
Right.
And so that's right now taking up a lot of time, but I would urge your organization, your leadership, and maybe working with Senator Farnese to think of an executive process. There may be a way that you can restrict someone's license if they're engaging in this type of practice.
And I believe Pennsylvania state government would look to Philadelphia for how your regulations would play out too. So I think it'll all complement each other.
Thank you.
Thank you, Councilman. And if there are no additional questions, thank you so much for your
Thank you.
testimony this morning. Is there anyone else here to testify on Bill number 161111? Okay, and seeing none, if we can have the clerk read the title of the next bill.
Bill number 170470, an ordinance amending Title III of the Philadelphia Code entitled Air Management Code by amending Chapter 3-200 thereof entitled Prohibited Conduct to add a new section prohibiting the cutting of rubber tires by any person under certain terms and conditions.
And can we have the clerk please call the first name of the panel to testify?
Cass Selassie, Director, AMS, Philadelphia Department of Health.
Good morning.
Good morning.
Please state your name for the record and begin your testimony.
Good morning, Chairwoman Bass and members of the Committee on Public Health and Human Services. My name is Cass Selassie. I am the Director of the Philadelphia Department of Public Health Air Management Services, known as AMS. AMS is the local air pollution control agency for the city of Philadelphia. AMS mission is to protect the health and quality of life of the Philadelphians from the adverse effects of air pollution. To this end, AMS is empowered to enforce federal, state, and city regulations and pollution standards within Philadelphia. Thank you for inviting me to testify in regard to Bill number 170470, which propose to amend Title III of Philadelphia Code Chapter 3-200 to add new section that prohibits cutting, tearing, or otherwise dismembering a rubber tire for any purpose unless the activity is conducted within completely enclosed building. It is the understanding of AMS that the intent of the bill is to prevent smoke, odors, or other air emissions from such activities from negatively impacting the public or the environment. AMS certainly supports what we understand to be the goal of this proposed legislation. However, AMS believe that these goals are already addressed by the existing Title III, known as the Air Management Code, the regulations passed by the City Air Pollution Control Board, and existing state law, which AMS also enforces. That there does not seem to be a need for this legislation. It is a mission of AMS to protect and improve the lives of all Philadelphians through enforcement of federal, state, and local air pollution laws and regulations. If there is a particular air pollution nuisance or problems that need to be addressed in the city, AMS is willing to work with City Council or anyone else to address the problem. Thank you for your attention, AMS staff, Keith Lemchuk, Pat O'Neill, and I will now be happy to answer any questions that you might have.
Okay, thank you. And Pat O'Neill is,
He's from
Okay.
Law Department, and
and-
Keith Lemchuk.
Keith Lemchuk is
okay,
enforcement.
all right, very good. All right, any questions? Councilman Greenlee?
Thank you, Madam Chair. Just quickly, sir, you said that does not seem to be a need for this legislation, but there's nothing in the legislation that is contradictory to city law regulations, right?
There is no contractual, but we already implement and enforce the MS code, which is such as 3-201.
No, I
It is
understand.
also about this one, and we have also Title 5, Regulation 5 and others. So it will not contradict, but the only problem for this one is it adds cost to the facility because
It adds
is
what?
a
I'm
small-
sorry.
It is a small facility, this one. So
Small.
a small
Facility.
Yeah, facility. So
You're saying it adds?
add costs for the facility to build. That is the only difference for this one. We don't need additional regulation, or even it
Okay.
is not. The contradiction is somewhere, like add cost, unnecessary, and we have other regulation.
I get what you're saying, but I assume the sponsor is trying to, has been alerted of a problem, and he's just trying to emphasize this. So if it doesn't contradict anything, I guess I don't see the problem. That's just my opinion. So anyway, thank you, Madam Chair.
Right, thank you, Councilman. And quick question, just following up on Councilman Greenlee's question. Are you aware, have you had a conversation with Councilman Squilla?
Yes,
Okay, so you are aware of his particular concerns?
yes. Last year in March 2016,
Okay.
I was with him in his office, 5 of us. So we discussed about the issues.
So I'm assuming that he came to air management to address a problem that could not, be adequately addressed by air management, and that's the reasoning for this particular piece of legislation.
Yeah, here is what I am suggesting. For example, now the technology, this is particularly for tire shredding facility.
Right.
So now there are a lot of technology out. The only problem this raises a question is they are using saw to cut tires. So they extract the steel from the wire, from the tire, so they recycle it. But there are other options. Instead of putting regulation ahead, we can use some new technology, like extracting. It doesn't create any smoke or odor or anything. So that technology, if someone uses that technology and we have implemented this regulation, so it is a big chaos, because what about those people who installed this new technology, which has no smoke, no odor? So Councilman Scola problem is there is smoke and odor from the tire shredding. So if we use the new technologies, there is no shredding, like cutting. So the problem is only saw cutting. So we have to avoid that one. We can work with the facility, with the councilman, how to proceed without any nuisance or any air pollution.
Councilman, if I may, I think the part of the objection, at least, is that as far as air management is aware, there's only one facility where there's been an alleged problem, and no place else in the city, and so it's sort of not exactly a spot zoning, but it's kind of it's a legislative change for what amounts to one facility, as opposed to an industry problem, which AMS has not come across. And if there's a problem at one location, AMS has the authority already, because of smoke, odor requirements, prohibitions against open burning, et cetera, that as long as we can find the problem, we can confront it, and AMS is ready to do that.
Okay. I'm just, I'm going to move on. I don't want to belabor the point, but I assume that, again, the councilman reached out and tried to resolve this before introducing new legislation to do it. And wasn't able to do so, and that's why we're here at this point. And I also would imagine that for most of the work that air management does, most of it is, a one-off, just a very, someone doing something different, unusual, that could be problematic. I don't assume that it's, it's not like, these are, like, almost like fast food restaurants. Like these are, like I said earlier, one-offs where you have one person doing one thing that is compromising air quality. And again, I'm assuming that that's why the councilman felt the need to introduce this legislation. So, but anyway, Councilman Toggenberger?
Thank you, Madam Chair, and this goes back to Mr. Salesi, and I think the panel actually started talking about it. So so I get this right, you're essentially saying that this piece of legislation really has to deal with only one operator, is that correct?
Yes, sir.
And where is that operator?
20,
It's in Kensington.
yeah, 2609.
Well, give me an
East,
address. I mean,
2609
Kensington's a big
Silver
space.
Street, yeah.
Excuse me?
2609 Silver Street.
2609,
2609 Silver Street.
Silver Street.
Yeah, Silver Street.
Okay. That's all I have. The only thing I have. How do you spell
It
that?
is Kensington.
It's just 2069 Silver Street, like
Silver.
like the metal.
Yeah.
Yeah.
The metal. Okay. Okay. Got it. Madam Chair, thank you.
Thank you, Councilman. Councilman Green?
Thank you, Madam Chair. I had a chance to read Ms. Gear's testimony, who will be testifying after this panel. And so my understanding from what you're saying is that this is the only location in the city where they're cutting tires that's in this close proximity to residents.
Right.
So there are other locations in the city of Philadelphia where they're cutting tires, correct?
Yes, sir.
Right, and so when they cut tires, they cut of the metal mesh in the tire and using a saw that's doing that, that's causing the smoke.
Yes, sir.
And in the other areas where the cutting tires occurs, those are primarily industrial I-3 locations, probably Southwest Philadelphia or other parts that are industrial locations, correct?
Yeah, that's an industrial location.
So what is your solution to Ms. Gear's problem, considering that this is a location which obviously, for whatever reason, has a business in a location that I'm presumed, what's the zoning classification of this property on Silver Street?
It is industrial zone.
So it's industrial,
And also residential zone.
so it's zoned, assuming an industrial classification, but its location is in close proximity to residential properties.
Residential, yeah. It is around 100 yards
Okay, so it's
from the
probably been there
residence.
for a long time.
100 yards,
Okay.
yeah.
So-
There are row houses around that one.
So within the current code, what they're doing is legal, but it's still causing for smoke and impacting the quality of life of Ms. Gear and other residents on the 2000 block of East Somerset. So what's your proposal to resolve this issue if you're saying that this legislation is not needed?
Yeah. We, as I said, we enforce smoke and odor. There is another regulation. So that the second one is we have to discuss with the facility and the councilman office because there is another solution. The solution one is we avoid using saw because that is the one creates smoke and maybe smoldering smoke. So instead of that one, there are new technologies. They have already, like cutting. If they cut, there is no smoke. It is a machine, it will cut like within seconds. So when they use a saw and outside the office area, which is near to the residential, that creates problem to the neighbors or to the residents.
So you're saying that there's new technology that's available and that using a saw to cut is no longer needed and that will eliminate the smoke?
Yes, that's what we do.
However, has the business owner, I mean, you said you currently have legislation and regulations under the code that can be used to, I guess, encourage the business owner to use new technology, but that has not occurred as of yet. So how do you reconcile the issue that you have residents who are still dealing with smoke and noise in their community and your response to this legislation is that we have existing regulations to address that, but nothing has changed.
It will change, Councilman, because even it is industrial zone, they have rights to have that business, but there is also another regulation, which is air pollution regulation. So they have to comply with that air pollution regulation.
Right, I understand. I understand they've got to comply with air pollution regulation, but what steps from an enforcement perspective have you taken in reference to the pollution that's been occurring with the smoke that's basically going on for some time with this business using the current technology to cut tires?
But for the record, they have two types of technology using.
Well, the question is not about the types of technology. The question is that they're currently using an older technology, which is causing air pollution and impacting the neighbors. And you're saying that this legislation is not needed, but you can use existing air pollution legislation and regulations to address it. My question is, how have you done that so far to convince this business owner to stop polluting the air and impacting the quality of life of the residents on Somerset?
I think two questions. They have using two technologies. That's what I'm trying to tell you. One is saw, the other is cutting the new technology. They have two on the side. So they have to avoid the saw, but using the new technology, which is cutting of tires inside the buildings they have already.
Okay, so
So we avoid that one, just so they don't have to use anymore, because it emits emission, smoke, and odor.
I understand. So you're saying that this business has both technologies, the older and the new technology.
Right.
But obviously they're still using the older technology and it's still causing quality of life issues to the neighbors. So what are you doing to basically use the current legislation and regulations to stop air pollution, to basically stop them using the old technology and impacting the neighbors from a quality of life perspective?
Yeah, that's a good question. So we have MS as authority. We can write work order.
But you're saying we can, as in the future.
We can write work order.
But you're saying we can, we will. Those are in the future. What have you done in the past, considering this is not a new issue?
Yeah, we did actually 19 inspection, for example. Here is a problem, Councilman. When we did 19 inspection, they call us, the neighbors. When we got there, so that they don't have any activities, all 19 times. The facility is very small facility, and I said one in Philadelphia. That is the only one. So they have tires like 10 a day, or sometimes they don't have any tires. So it is not like stockpile that they have
And
tires.
So let me give you some perspective. I've worked for a district council person in
Right.
the past, and when we've had issues with a specific business or individual engaged in a certain pattern, that we've normally provided information to air management saying that
Right.
usually on this time of day, this is when they are cutting tires or doing some type of activity. So are you just only coming after the calls you're receiving from the neighbors, or have you worked with the neighbors to find out what's the pattern of cutting tires and when they cut tires to make sure that you're maximizing the neighbor's time and your time, that you're coming out at a time when they generally are cutting tires? Is that early in the morning, in the afternoon, in the evening, not just responding to the 19 calls and coming after the call and then they're not cutting tires anymore?
Councilman, yes, you are right. Sometimes when we get there, they might done. So what we have another operations type, which is we call it surveillance. So that now what is the future for, to answer your question, I will assign an inspector
So you're saying
there.
going forward, you're going to now do surveillance, but after 19 times, the
No,
thought
no.
of doing surveillance didn't come
Before
up?
we didn't have that many inspectors that time. We were shortage of inspector because of the budget. Now we hire four inspectors additional. So those inspectors, we assign that location. Like for example, carbon monoxide, we give priority. Anything happen, we go. So I will give this facility a priority, so the inspector will be there every day. That's my plan until we resolve. But between that
But
time,
that's not an efficient use of time. To me, what it probably would have made more sense that after you received, let's say, the 8th, 9th, or 10th call, to maybe work with the neighbors to try to find out what's the usual time that they are cutting tires, and then you can designate someone to come out at that time period when there's a pattern, so that way you're maximizing your office's time as well as the neighbor's time, as opposed to just now, after 19 calls, having someone come out to spend all day waiting for them to cut tires.
I mean, we did all those.
Well, no, you haven't done all those. You're now doing it in the future. I'm just telling. I mean, this is about a resource management perspective and a quality of life customer engagement process. I mean, it's not that complicated.
I will give to the head.
You have a limited amount of resources. The neighbors have complained for a number of calls and complaints. It's a matter of someone being, using some perspective to say, when do they generally cut tires, so that way we can have someone there at that time period. Now, you may not be able to catch it every time, but I would think the neighbors have developed a pattern because they called you 19 times. It's probably been more than 19 times that cutting tires have occurred. So most businesses have a general pattern of operations, and that would be more efficient for your time as well as neighbors to get this issue resolved.
Yeah, Councilman, you're correct, but we've done surveillance, talked to the complainant to get the time when it happens, but it's so short and infrequent that we're unable to observe the actual cutting.
Okay, now that makes more sense,
Yeah.
because they only have a small number of tires of 10 at a time. That by
the time someone gets out there, even to address that, we've set up, random times
Random
to just
checks
get ready
okay,
based
okay.
upon the time that we're given.
All right.
Also, if necessary, we can install camera. I mean, we did it in the past here in downtown here.
Right, that's another concept that maybe should have come up earlier before now, installing cameras. But that's something you're planning on doing. And so what is the penalties if you install cameras and find them cutting tires and causing air pollution? What are the penalties for that's different than this legislation?
The penalty is the first one, I think, $300. Then if it is the second time we do, $500. It will go up 1,000. But if they continue, so we'll take them to the court. That's why the law department we have this part. So that's the procedure we do.
So under the air pollution portion of the code, first fine is 300, then 500, and after that is cease operations?
After that, we take them to the court. We give to the law department.
Right,
to
code
pay.
enforcement court, but at that point, is that, Mr. O'Neill, that cease operations? After two
AMS
fines?
doesn't have the authority, unless there's an actual health hazard occurring, to issue a cease operations the way L&I does. They can issue an order, and that can include stopping the action if they sort of have an actual health, if they can verify that there's a health risk. But that's kind of unusual.
But, so air pollution
But when you
can't
think of a cease order,
operations?
the way L&I issues a cease order, they don't have that authority.
But air pollution is not a significant level of public safety for health risks for cease operations?
Well, you can have an air pollution nuisance that's not a significant health risk.
I understand it, but I would say within that same construct, if someone had a significant air pollution, that would be a public safety matter. that you
Yes,
would
we
think
could go
cease
in,
operations.
we would go in and get a TRO if we needed to.
But through AMS, you couldn't get a cease operation, you all can do a TRO.
We can issue an order from the health commissioner, but it's not the same thing as a cease
Right.
operations order the way L&I does it.
Okay, but don't you think at the highest level of air management, that if you have a significant pollution event, that should be a level where a cease operation should occur?
I think.
Yes,
I mean, that seems like a gap in the code.
but this is not, well, I mean,
you
nothing
have
has been
different
documented
levels. I
here.
understand different levels of air pollution. That's a little bit different than this conversation. But still, at some point, I would think that if you have a significant air pollution matter, you should have the ability to do a cease operation, because that is a public safety matter, causing a health risk.
And AMS can have an order issued through the health commissioner that would effectively do that.
Okay. All right. Thank you, Madam Chair.
Thank you, Councilman. Thank you, Councilman. Councilman
Yeah,
Talkerberger.
thank you very much. I I was able to Google the location of this, and we're going to hear some testimony, which I'm very anxious to hear from Mrs. Gear. But in your estimation, well, a couple things. How many employees work there?
Good question. I myself visited that facility on May 9th, 2017. They are like two or
people?
three. Yeah, that's why I saw them. And those, one is, he mentioned his history. I mean, he was like a homeless, one of the employees there, and he has a chance to work at the facility, so he improved his life and everything. So people like that, 2, 3 people. It is not a big facility.
No, I
it is a
understand,
small one.
but
Yeah.
if they're causing, bad air for constituents, it's not a good thing. At this point, I'm gonna wait to hear with Mrs. Gear. You've answered the question that I needed to.
Sure.
All right.
Okay.
Thank you, Madam Chair.
Thank you, Councilman. Thank you for your testimony.
Thank you.
And if we can have the clerk call up the next witness to testify.
Genevieve Gear.
Good morning.
Good morning.
Please state your name for the record and begin your testimony.
Genevieve Gear. Should I start?
Yes.
Okay. My husband and I live at 2060 East Somerset Street in the Kensington section of Philadelphia. Within a 5-block radius, we are surrounded by 3 different scrapyards. Our property backs up against Philadelphia scrap metal, as do about 24 other homes. Within the first month of moving in, we discovered that about every other day, sometimes many days in a row, the sound of a loud saw could be heard, and the air would become thick with an acrid burning smell, and clouds of smoke would waft into our yard and the surrounding yards. My first action was to call the fire department whenever it happened, because clearly something was on fire. Sometimes I would call twice in a day. I began writing emails to Councilman Squilla and discussing with neighbors how long this had been going on. The word on the block is that this had been happening for all the years Philadelphia scrap metal has been at the location, at least 10 years. It soon became apparent that the fire department could not help because they cannot give out violations. I was sent along to air management. I began calling them with complaints in the latter part of 2013. The air management department in Philadelphia is woefully underfunded, with just 2, or now 4, enforcement officers for the entire city. It can take up to a full day for them to get to the site, in which time the offending material can be removed. And what finally became clear is that the way in which the tires were being ignited is legal under Philadelphia code. Cutting tires. The smoke generated by this scrapyard is created from a practice of cutting the tires in half with a power saw so that they can be more easily stacked inside a container truck to ship off to wherever they have been sold to. The U-shape maximizes the packing space within the container truck, thus making the scrapyard money. When the tires are cut with the saw, the metal mesh that is embedded within the tires heats up and ignites the tire from within. The tire begins to spew large quantities of smoke that goes into the air of our neighborhood. I've been able to make 2 videos of the process, the most recent one on June 2nd, and am happy to email that along to anybody who would like to see this. Some notes on the smoke of burned tires. There are over 2 gallons of petroleum and oil in one tire. Each tire contains chemicals including chlorine, styrene, butadiene, and more than 20 different heavy metals. These heavy metals, like lead, chromium, cadmium, and mercury, don't burn away, but are released into the atmosphere as fragment ash. Dioxin is a byproduct of burnt chlorine, and once released into the air, travels far and wide, settling on soil, water, and plants miles away. Dioxin has been shown to be responsible for reproductive impairments and an increased risk of diabetes. The chemicals from tire burning, once in the soil, remain active for up to 200 days. Small particulates released by burning tires worsen asthma. Breast milk contaminated by the heavy metal particles released from burning tires transfers from a nursing mother to her baby. And finally, fine carbon particles have been found to cause excess mortality and hospitalizations for heart disease and cancer by the American Academy of Pediatrics Committee on Environmental Health. I have had comments over the past 5 years that I should have known better than to buy a house near a scrapyard. I didn't know better because I assumed that laws were in place to protect the health of myself, my family, and my neighbors. I ask that this ordinance be put through to move us toward a greener, healthier future for all Philadelphians. These are third world standards that can easily be brought up to first world standards by our efforts today.
Okay. Well, thank you very much for your testimony. I think it's been very comprehensive. And Councilman Toggenberger?
I at some point would like, if you would release that to the chair to see those videos.
How would you like me to do that?
Just email to the...
Email, I'll send them along.
give
The
it to-
Dropbox, okay? Dropbox?
Well, whatever Councilwoman's technology.
We'll
I'll
figure
talk
it
to
out.
Angela.
Yeah,
We'll figure it out before you go.
We'll figure it out. Now, just so I have this correct, the company that was described, is that basically a two-person operation as you've seen it?
It looks like maybe there's one owner and three or four, the employees seem to change, so I'm not really sure at any given time. I have videos with one guy alone in the scrapyard and then 3 guys, so like that. It's a smaller operation.
And have you complained to them directly as well, or no?
Yes, I've complained to them. I've complained to everyone, Ellen
I get it.
Councilman Squilla, poor Councilman Squilla, yeah.
Okay. And how long have you lived there?
5 years.
Okay. Madam Chair, thank you.
Thank you, Councilman. Councilman Green?
Thank you, Madam Chair. Ms. Garrett, thank you for your testimony this morning. What has been your response you've received from the owners of the business when you've addressed them?
I mean, it's like I'm like a nuisance on their yard, like it's a joke, you know, just like go away, so.
Okay. And what are the hours of operation based on your observations?
I think it's 8 to 4 or 5, something like that.
Is there any specific time from I know you said you've made videotapes. How were you able to compile those videotapes of the
Well, you
cutting?
can hear the saw go off, and then you see the smoke, so you know to go around. But it's usually morning is their usual thing, and also rainy days. They really like rainy days because it keeps the smoke low, which I guess is a nice thing for us. But
And so generally you've seen, and so the 2 videotapes that you made were both in the mornings?
yes,
Okay, and were they like 8 o'clock, first thing in the morning, 10 o'clock, 11 o'clock?
I think one of them might have been. I don't actually know, but I do know they were both early morning because it would have been like when I was headed out. I hear
okay.
it and I just swing by.
And do they tend to do the cutting more early part of the week to the end of the week?
It's totally haphazard.
Totally haphazard?
Yeah.
Okay, but definitely mornings throughout the week generally?
For the most part. I mean, it can go for a while, or it can be just an hour, or, you know, the length of time, it varies.
Okay, but what's been the average shortest length of time that
The
you?
shortest, I would say, is an hour.
An hour?
Yeah.
And then longest you've seen?
It'll start and go through a whole day, like maybe they got a bunch in or something, so it'll stop and go, but it usually doesn't go past 2 o'clock in the afternoon.
So possibly 8 or 9 till about 10 o'clock, or?
I would go till 11.
Or
I'd say
till
between
11.
8 and 11 would probably be.
And then sometimes till about 2 p.m.
Yes.
Possibly.
Yes.
And so what's been your interaction with the city from the air management?
So I began calling them in the latter part of 2013. At first, they were helpful, and then there was a dramatic shift, and I'm not really sure if staff changed or what happened within the department. There was a dramatic shift. I had heard different things that air management was sort of done talking to me about this issue. And I'd also like to note here, just as an aside, that there are many people who live in that area who called air management long before I was there about this issue. But they are done with it. They think this is just how it's going to be. They think there's nothing that can be done because nobody has taken action about this. And then I've finally kind of given up in the past, I would say 6 or 7 months since last summer, and just been basically just badgering Councilman Squilla. to help me with this problem, because air management they get there so late and they really just don't seem to take it seriously. They think that, I don't even understand the reasoning. It's an air management department. I don't understand the resistance to managing the air at all.
And so when you've called air management, how will the time period that air management has generally come to the site, from your understanding?
From my guess, I usually call them because I open the back door and I hear and I smell and everything. So I'm usually calling them on my way out. My general impression is that they come within 2 hours, but I know that a few times where I haven't been going out, it's been almost an entire day, especially in the very beginning. Back in 2013, it would be about a day. And I haven't really been utilizing them in the past 6 or 7 months.
And from 6 to 7 months prior, have you seen any air management staff there to do any surveillance or information that you're aware of?
No, I mean, in all reality, they can't surveil. There's up until recently, there was only 2 rotating air enforcement officers for all of Philadelphia, and they don't just manage pollution, it's also sound, and so they can't surveil.
And that was actually my next question. Have you reported any sound issues in reference to the air pollution as well?
I haven't. It just came to me recently. I'm like, oh, that's also annoying. It was just so concerned with the air, that's the smell. I mean, it's burning rubber, so that's sort of what I've been focused on, but the sound is awful too.
Okay, all right. Thank you for your testimony and taking time out your day to come here this morning.
Thank you very much.
Thank you, Councilman. And I want to acknowledge Councilman Mark Squilla.
Thank you, Madam Chair, and apologize for being late to the hearing. I think 2 important bills that were before you. On this note, though, Jenny, thanks for coming in and testifying. Actually, it was her idea when we talked about coming up with a way to try to stop that. And when we did, air management has been responsive and all, but they're saying that really nothing they could do. There is no law that prevents it. They go out there, and usually by the time they get out there, it's already done. But we've thought that if there was a law saying you cannot cut the tires and burn the tires, then they would have to find another way to do this, whether taking the tires off the rim mechanically and then feeding them out to wherever they need to go. Didn't know how that would be a detriment to that business. So, as the quality of life for the surrounding neighbors, it's bad enough you have to put up with everything else with the yard there, and why should we have to put up with this part of it? So it was actually Genevieve's idea to come up with that, and I thought it was a good idea, and I said, let's try it. I guess you heard before her that the administration doesn't think it's something that's enforceable or be harder to enforce, but I still think it's something that we need to look into, and sort of there's no rhyme or reason why we would have that as a legal way to perform a business. And so, I would ask the chair and the committee if you would consider at least moving the bill out and go from there. So thank you.
Thank you, Councilman. Councilman Green?
And one other quick question. Thank you, Councilman Squilla, for that background. Ms. Gear, have you noticed them cutting from your observation where you've not seen smoke?
No, there's always smoke. There's no way to cut a tire that way that you don't get smoke. There might be an extraction process, but if there is a new technology, then it won't matter if we pass this bill to them or not. So we should just pass it.
Okay, thank you.
Yeah.
Okay, well, thank you so much for your testimony today.
Thank you all for hearing me.
Is there anyone else here to testify on this bill? Yes.
Madam Chair,
Yes, sir.
just also my support for the conversion therapy bill. I just wanted to put on the record that we support that and appreciate the committee's help.
Thank you, Councilman.
Thank you.
Good morning.
Good morning.
Please state your name for the record and begin your testimony.
Amanda Fury. All right, and let me introduce myself. I'm one of the steering committee members of the neighborhood group, the Somerset Neighbors for Better Living, of which Genevieve is also a member. And we're a community group that's been active in that area for about, I'd say, 7 or 8 years. So I want to paint you a little bit more of a picture of the neighborhood that might answer a couple of questions that were brought up. And I'd also like to give you 2 reasons that this would be a really good bill to have passed. So we've had a community group for the past 7 or 8 years, and it's an RCO, it's a nonprofit and we work to give the residents of our neighborhood more of a voice. You probably know that there are a lot of vacant industrial properties in many parts of Philadelphia, and that definitely describes our area. We also have a lot of residential properties, and as those vacant properties, those industrial properties, like people realize they're never going to be turned back into factories, the residences and the industry have really grown closer together. We actually went through a zoning remapping process recently, so many of the properties that we talked about, the scrap yards, while they are zoned for heavy industrial right now, we've asked that if they were to be relicensed in the future, that they be a lighter form of industry. So we are asking to have that heavy industry moved out of our neighborhood because of its negative impact on our residents. So we're actually advocating to create that. So the two reasons I think it would be really good to have this bill passed is, if you listen, there's a lot of nuisances and a lot of often downright illegal behavior. I used to pass by one of the 3 scrapyards in our neighborhood on a daily basis on my commute, and you'd have illegal things like dumpsters and trucks idling out in the street. And it would take the residents calling over and over and over again, and finally L&I would come out. So it's like, even for a legal violation, it would take a lot of work. And this the burning of tires, the cutting of tires business, I could smell it every time I rode by. Sometimes it was clearly happening right then, sometimes it was not. But imagine how frustrating it is to have to call 20 times to get action on an illegal thing, but imagine having that poor quality of air and you find out that actually it's completely legal to do that. So it's really important that we pass this, because it is actually very toxic to ride through. And if this law is not passed, or if this is not passed, then we as residents just have no recourse to call it into L&I. So, and secondly, while I disagree that it is only one problem scrapyard, I have passed by at least 2 or 3 that have been doing this. And I'd like to remind you that we are not the only neighborhood where industry and residences are moving closer together. And I have personally seen the Somerset Neighbors area start to find a voice. It's a lower income area, so I believe that 10 years ago these problems were still there, but residents very much felt disempowered to do anything about it. So as other areas in Philadelphia find their voice, I like to think that they too will start to push out against this. But right now there are probably many communities that suffer from these issues and just feel like there's nothing to be done. So by putting this into law, our neighborhood will be able to get something done about the burning tire smoke, which currently is completely legal. And also, I think that it'll help serve other communities when they are trying to do the same thing.
Okay.
Thank you.
Well, thank you very much for your testimony. Any questions? Councilman Green?
Madam Chair, I'm glad the witness brought that up, because I know it was brought out earlier, this is about one property, and even if it was one property, that's enough to pass the law. But I doubt very seriously if there aren't someplace else in the city of Philadelphia doing the same thing, or maybe tomorrow one will pop up. So, to me, this is easy. You pass the bill. Thank you.
Absolutely. Okay, thank you very much for your testimony. Is there anyone else here to testify on bill number 170470? Okay, and if not, that concludes the public hearing on bills number 161, 111, and 170470. We will now go into a public meeting to consider the action to be taken on these bills. And I want to recognize Councilmember Bill Greenlee for a motion on bill number 161, 111.
Thank you, Madam Chair. I move that bill number 161111 be reported out as committee with favorable recommendation that the rules of council be suspended to allow for first reading our next session of council.
Second.
It's been moved and properly seconded that bill number 161111 will be reported from this committee with a favorable recommendation, and further move that the rules of council be suspended to permit first reading of this bill at the next session of council. All of those in favor of this motion signify by saying aye.
Aye.
All of those opposed? Okay, the ayes have it, and the motion carries, and bill number 161111 will be reported from this committee with a favorable recommendation, with a request that the rules of council be suspended to permit first reading at the next session of council. I now want to recognize Councilman Bill Greenlee again for a motion on Bill number 170470.
Thank you, Madam Chair. I move that Bill number 170470 be reported out as committee with favorable recommendation that the rules of council be suspended to allow for first reading in our next session of council.
Second.
It's been moved and properly seconded that Bill number 170470 be reported from this committee with a favorable recommendation, and further move that the rules of council be suspended to permit first reading of this bill at the next session of council. All of those in favor of this motion signify by saying aye. Aye. Any opposed? Okay, the ayes have it, and the motion carries. Bill number 170470 will be reported from this committee with a favorable recommendation, with a request that the rules of council be suspended to permit first reading at the next session of council. And that concludes the business of this committee. Thank you.